Hi, I'm Dr. Greg Castello, Board Certified Family Practice, and today we're going to talk about how to perform a self-breast exam. So first off, you want to be doing your exams about once a month, mid-cycle, away from your period when your breasts are less tender or swollen, so you can get a better exam without being uncomfortable. There's two parts to the exam. The first part is inspection, or looking at your breasts, and the second part is palpation, or feeling your breasts. So when you look at your breast, you want to look in the mirror, and first off, you look for symmetry, that the breasts look the same, that the nipples are both pointing out, that one's not going in, there's no discharge from a nipple, they look like they did the month before, that there's no changes to the skin or to the nipple, so what may look like irritation or scabbing or thickening of the skin is actually a type of breast disease called Paget's disease of breast. It's almost like a skin cancer that involves the breast, and you'd only see that on inspection. It has what's called an orange peel appearance, so thickening of the skin or thickening or scabbing of the nipples. Discharge, or bloody discharge or clear discharge can be indicative of breast cancer as well, and these are things that you would see on inspection. So first, after you look in the mirror, everything matches. You want to put your arms up over your head and look again. So when you put your arms up like that, you're lifting the skin, and the thought is that if you had something like a tumor stuck to your skin, when you bring your arms up, you might cause dimpling of the skin or asymmetry of it. So with the arms up is the first step. The next step is you make a muscle, kind of push your arms together like that, and the thought with that is that when you make a muscle, if there's a tumor stuck to the muscle below, you're going to cause a deformity of the breast on one side. Lastly, you lean forward, let the breast tissue kind of fall away from your chest, and you look again and see if there's some asymmetry. If there's this matting or sticking of the breast tissue, they're going to hang or fall a little bit differently. So that's inspection. It is a very important part of the exam. The second part is palpation. You do one breast at a time. You can either do it standing up in the shower or lying on the bed. If you have larger breasts, you probably want to lie down with your arm behind your head like this, and that flattens out the breast tissue and lets you look not through as much, through as much tissue because it's a little bit flatter. When you're standing in the shower, the breasts are hanging down. They tend to be a little bit fuller or thicker. So if you have smaller breasts, this is better. If you're very, very thin, you sometimes want to do it standing up so you don't feel the ribs and the muscles as much underneath. Soap and water on the skin gives it a slippery texture, so if you're in the shower, soap and water is helpful. If you're lying on the bed, put some lotion on your hands and use lotion. The way you find a lump is not actually by landing on the lump, it's from falling off the lump. So I use this as an example. I'll poke on the edge of your ribs, and I don't necessarily know where I'm at until I fall off of your ribs. So as my fingers go up and down, on and off your ribs, I can appreciate that I'm falling off of a lump. If I just put my fingers down, I don't necessarily know that that's a lump until I fall off. So that soapy skin, or the lotion on the skin, gives you more of that slippery kind of a feel. You want to divide the breast into areas, so you can either do big circle, medium circle, small circle like a bullseye. You can go left to right, top to bottom like you're reading a book. You can go in and out like slices of a pie. It doesn't matter how you do it, just kind of get in the habit of doing it the same way every month. Your breast tissue actually has a little tail that goes up like an upside down comma shape called the tail of Spence. So you actually have breast tissue all the way up towards the armpit. So you want to make sure you start your exam kind of high because that's breast tissue. If you want to be fancy, you can poke in your armpits as well and feel for lymph nodes. When we do the exam in the office, we're going to poke in your armpit and check for lymph nodes. You can do that as well because if you have breast disease, sometimes you'll feel lymph nodes. If you have larger breasts, you probably want to do it in a couple or two or three different intensities or pressure, so just a very light pressure sensation to feel the outer breast tissue, then a second time around a little bit deeper, and then the third time out the fullest depth, so you can feel different layers of the breast tissue. A lot of women have what's called fibrocystic breasts. That's a normal lumpy bumpy. Breast tissue's lumpy. The fat cells, the milk glands are both lumpy, almost like cottage cheese. When you have fibrocystic, you almost have matting of tissue, and it can make your exam very, very difficult. The things that we can use to help differentiate fibrocystic or normal lumpy bumpy from an abnormal bump is as if it's the same every month, so you know what parts of your breast you're most tender in. The other thing is that kind of mirror image. So if you're tender in or lumpy bumpy in the upper outer quadrant on one breast, you kind of should be very similar on the other breast. So in the office when we do an exam, if I feel lumpy bumpy, as a reassurance, I'll go to the other side and see if I feel a very similar lumpy bumpy. Okay, that said, fibrocystic breast is difficult to palpate, and you absolutely could miss a lump, which is why you do need to go to the doctor once a year, why you should get your regularly scheduled mammogram when you're 35 or 40 at your baseline, because you're not going to feel everything in your breast tissue. So 2 parts to a breast exam: inspection and palpation. You're looking for skin changes, you're looking for dimpling of the skin, asymmetry, discharge from the nipple, all during the inspection. You're going to do it in the different positions and see if you can elicit some abnormality doing that. And then the palpation, either standing up in the shower or lying on the bed. Use soap and water or lotion to get that slippery skin-on-skin texture. If you have larger breasts, you definitely want to lay down with your arm out flat. If you're smaller breasted or very thin, you probably want to be standing up in the shower to let the breast tissue fall off of the ribs underneath so you're not feeling all your rib tissue. If you're not sure, go to your doctor. They'll order a mammogram. They may order what's called additional views. So if you go and get a mammogram and they call you back for additional views, don't panic. It may just be that they didn't see all of the breast tissue and want to take an extra picture. Sometimes they'll bring you back and do an ultrasound to see if what they're seeing as a lump is solid, which is more like a tumor, or if it's clear or water-filled, more like a cyst. If you have tender breasts, laying off of caffeine can help. Taking ibuprofen can help. Avoiding doing your exam during your period or around your cycle can help as well. The most important thing is get in the habit, do it every month, do it the same way every month, and you kind of learn where you're lumpy, bumpy, and where you're normal. Dr. Greg Castello, thanks.